Hello and welcome to the Visual Answers YouTube channel. My name is Gazim Bajani, lead optometrist at Visual Answers Opticians. And today I'm delighted to be joined by award-winning doctor and laser eye surgeon, Dr. Tahera. Welcome.
Hello.
Hello, hello. In today's video, I'm hoping to ask her the most common questions we at Visual Answers receive with regards to laser eye surgery. So for the audience watching, and for those who don't know about laser eye surgery, do you mind briefly explaining what it entails and the different types of surgery that are available?
Okay, so laser eye surgery is a way of correcting any sort of visual correction, short sight, long sight, and it is done by changing the shape of the front of the eye by applying laser to it, microns of tissue shaved away to change the shape so that the focusing improves. In a nutshell.
A few questions I have about the actual procedure. Many patients ask if it hurts.
So actually, all the procedures are done under local anaesthetic. So we put drops to numb the front of the eye. So the procedures themselves are pretty much painless. Obviously, you're aware that we are touching around your eyes because the skin around your eyes is not numbed, but the actual eye itself is completely numb and it is essentially a pain-free procedure.
Approximately how long does the actual procedure take?
About 10 minutes each eye.
Pretty amazing here.
It's super quick, super slick surgery. I have to say, for me, laser eye surgery is modern medicine at its very best.
How often or how long does the surgery last for?
So that's an interesting question. When you get glasses or contact lenses, we go for an eye test every 2 years and we have the ability to tweak that prescription a quarter this way, a half that way throughout life. So if you have small changes in your prescription, as optometrists, that's what you do. You kind of superbly customize that vision to the person's eye. Laser eye surgery is slightly different. We do one procedure to last your lifetime. So we do the laser as you are at that time with a little bit of give for what might happen in a year this way or that. But ultimately, if you have a large change in your vision through genetic programming, if you were always designed to be -3 by the time you're 30 and you have surgery -2 when you're 20, of course that -1 shift will happen irrespective of what we've done. But if you have -3 surgery at the age of 30 and that is your prescription, that is going to last. In the same way, the same pair of glasses, sometimes you can make those last for a number of years, can't you?
So to follow on from that, once you've had laser eye surgery, if for example there is a tweak in the prescription, can that person have it again?
Absolutely, we can go back and do laser eye surgery again. Normally we don't undo the good work that we've already done, so we usually go over the surface and just give it a little bit of fine tuning if we need to.
Is there an ideal age to have the surgery itself?
That's a good question. So there are different schools of thought on this. At one time we used to always suggest that people waited until their prescriptions were reasonably stable, mid to late 20s. Because we know that certainly in your teenage years and those early years, as the body is growing, the eye is growing, the prescription is changing. But once you get into your mid to late 20s, generally speaking, your prescription has stabilized. Unfortunately, nowadays, we spend so much time on close devices that sometimes stability doesn't happen until a little bit later than that. Some people continue to progress throughout life. So now we don't say there's an ideal age. We say if you're ready for your laser eye surgery, as long as you've not had a dramatic change in your prescription in the last couple of years, you can come and have it done. But we explain the advantages and disadvantages of waiting if you decide to.
Sounds good. Often in clinic, we often say if they're keen for laser eye surgery, if they've had a stable prescription for a couple of times since they've seen us, we often then say, yeah, probably this is a good time to go, as it were.
Absolutely.
Fair to say. Some people are confused in terms of the types of prescription that they have and whether they would be suitable to have laser eye surgery. Can you expand on this a little bit more? Who is capable for it?
For sure. So at one time, we would only treat people who were short-sighted. So they're people who couldn't see in the distance, but were able to see without glasses up close. And now actually technology has moved on so much that we can treat people with long sight, people with short sight, people with astigmatism, people with glasses just for reading. There are lots of opportunities for surgical correction of this type of vision.
In the testing room, often patients with higher astigmatisms inquire about laser eye surgery. Is there a range in terms of the astigmatism prescription that's allowed or preferred?
There are upper limits to all of these things, and we are often confined by the measurements we take of the eye, because before we do any type of laser eye surgery, we run a battery of tests, including the curvature of your eye, the shape of your eye. So it's difficult to give one number that is going to cover everybody, but certainly even what you would consider to be a high astigmatism patient, in your case maybe over -3, -3.5, even those patients can comfortably be accommodated with modern surgical techniques.
Another question, should someone who's had laser eye surgery still have an eye exam even if they have 20/20 vision?
Absolutely,
what do you advise for patients on this?
100%, yes. It is extremely important, even if you've had laser eye surgery, even if you're glasses free, even if you have perfect vision, to go for regular eye tests. One of the things about high street optometrists is that they test for things other than glasses. They look at the health of the back of your eye, not just the health of the back of your eye, your general health will manifest itself at the back of the eye sometimes sooner than any other part of your body. So it is absolutely mandatory that people continue to have regular eye tests. Not only that, a lot of laser eye surgery companies offer something called a lifetime guarantee. So if you've had laser eye surgery, they will continue to look after you for a nominal or free of charge cost as long as you have regular eye tests. And the reason they stipulate that is because then it is very difficult for you to run into a long-term problem, because your optometrist will pick it up.
Another question we often get is with regards to dry eye and laser eye surgery. So patients who have dry eye before they have the surgery, they're often worried that they might find it more irritable, for example. Can you comment more on this as well?
For sure. So first of all, a severe dry eye is a contraindication to surgery. So it's one of the reasons why we don't operate. But a mild dry eye may not be. The commonest cause for dry eye in patients before they come for laser eye surgery is contact lens wear. So if you have a dry eye that is only associated with contact lens wear, and if when you take the contact lenses out, the dry eye recovers on its own, then these are people who are normally suitable for surgery, because then they can go on and have surgery. And of course, after surgery, you can also get a dry eye. It is the commonest side effect after laser eye surgery. But it tends to be short-lived, and it tends to be quite easily treated with something like a preservative-free moisturising drop. And there are some people who are more prone to a long-term dry eye, and we discuss that risk with them at the time of consultation.
Can you reiterate some of the other complications or some of the other effects potentially from laser eye surgery as well?
So the commonest side effects, I always say the common things that are common that happen to everybody tend to be short-lived. So a bit of dryness, a bit of redness. Sometimes, occasionally, people have a little bit of delay in getting their perfect vision. Instead of getting it within a day or two, it might take a week or two. Those things are quite common, and we tend not to worry about them because we know they are short-lived and they'll get better. We give you antibiotics to use after surgery, we give you preservative-free lubricating drops after surgery, and within a month or so, all the drops are stopped, with the exception of the lubricating drops, because we ask you to continue those for about 3 months afterwards, because well-moisturised eyes are like well-moisturised skin. It's just healthier. You know, we often just add a bit of moisturiser to our hands because it's a good barrier. Exactly the same with the eyes. In terms of other side effects, of course, as I said, no surgery is without risk. The kind of things people are really scared about almost never happen. We discuss those in the consent form because that's part of our medical duty of care, but we try and put those risks into perspective. People are terrified about flying on planes because we don't do it very often, but actually the risk of flying in a plane is really quite low. Similarly, the risk of surgery is really quite low, but it worries us because we don't do it very often.
Are there any new advances in laser eye treatments you can talk about?
So actually, medicine is advancing all the time, and technology in medicine is advancing at a very rapid rate. Certainly there are laser procedures available now, the scope of prescriptions that we're able to treat now that were not available even 10 years ago. There are intraocular lens procedures, there are implantable lenses without removing your original lens that we call them implantable contact lenses, that for people who are not suitable for laser eye surgery. There are procedures like SMILE, which is a laser-assisted type of surgery that changes the shape of the eye without shaving tissue from the top. The list is endless.
Numerous. No. Medical technologies are advancing all the time.
Absolutely.
It's pretty impressive. Now, if someone watching this video wants to be treated by yourself, where is it? Where would they go to find you?
So I work for Optimax. They are one of the largest laser eye providers in the UK. They have clinics up and down the country. I work mainly in Birmingham, and in Leicester. So they have a big, beautiful chain of network of clinics across the UK.
And we often recommend Optimax to our patients for those who are interested in laser eye surgery as well, which is really good. And finally, when you're not performing laser eye surgery, what is the other things that you do?
So obviously ophthalmology is my primary qualification and laser eye surgery is my area of expertise, but over the last 20 years I have diversified into treating in facial aesthetics. So I treat people with botulinum toxin and hyaluronic acid fillers, which actually began their life as ophthalmology medications, which is why a lot of ophthalmologists have diversified into aesthetic medicine, because we know a lot about those products. And so it seems like two very separate things, but they're actually very closely allied. So
Perfect. And your clinic for this is where?
Oh, so I'm based in Loughborough, not that far away from yourselves, at the Laser and Light Clinic in Loughborough. I also have a practice in Harley Street in London.
Perfect. And what we'll do is we'll put the descriptions of the Laser and Light Clinic in the description below as well.
Oh, thank you.
Thank you so much, Dr. Tahera, for taking the time to talk to us. It's been a real pleasure, and hopefully it's given helpful insights into laser eye surgery itself. I hope you enjoyed this video, and I hope that it was informative for you. If you found this useful, please like, share, and subscribe to our YouTube channel. Thank you very much for watching, and we'll see you on the next video.